You probably already know by now that retinols are great for your face. But what areas are we all forgetting about that might benefit esthetician and laser clinician Paige Ramirez from Derma Health Skin Laser is here to tell us what the pros have been gatekeeping. Okay, so obviously we know to put it on our face.
Yes.
I feel like I can guess another of the couple areas, right? You went on your neck?
Absolutely. Yes, absolutely.
And where else?
Chest.
Okay.
Face, neck, chest, keep it all in the same decade. A lot of the times I do the back of the arms as well for those little bumps that we get.
Yes, I do get those.
Yes. Only thing with body is if we're putting it on face, neck, chest, you got to put sunscreen on face, neck, chest. You have to put sunscreen on the arms.
Okay.
Anywhere that you treat. A lot of people like to put retinol on like their knees for any dark spots or their elbows. So those are very helpful.
This is great information. Because sometimes you put it, you put whatever, a dime size, right, amount on your face. Then you go, okay, I know I'm supposed to do this. But I never think to like do the arms and the knees, and there's still some on your hands.
Oh, absolutely. And I am always like a 1 pump for the face, 1 pump for the neck and chest, 1 pump for the arms. So I burn through retinol.
But then you don't burn because you put the SPF on it.
Exactly.
So when it comes to retinol products, I feel like there are 2 tiers. I mean, there are probably 200 tiers because there are so many, but there are 2 basic tiers, which is medical grade, what you work with, and things that you can find in a drugstore.
Yes, and the big difference is efficacy and potency. There's lots of different types of retinol. There's, those straight vitamin A's, which are going to be like a tretinoin, things that you would get from your dermatologist. And then there's the medical grade type that I work with. And then there's drugstore product. Drugstore product is made for the masses, so it's going to be a lot easier for your skin to tolerate because it's not as potent, right? We're not going to see those immediate results. So it'll take a little bit longer to get there.
I'm glad you mentioned that because especially for the medical grade, or if you get a prescription from your doctor, either for acne, for wrinkles, for any of the other things it treats, sometimes you can get either a purging or a burning. And a lot of people, they do what's it called when you sandwich it? You put moisturizer over?
Yes, the sandwich method for the more potent ones.
Right.
There are some non-irritating retinols out there. I have a couple examples up here that will be a little bit more on the gentle side. But most importantly, getting a professional opinion to really tell you what is going to be the best for your skin, how are we using it, and when are we using it.
And we all know to wear sunscreen, but in your practice, do you find that people are wearing it enough, i.e. they're putting a large enough quantity and they're reapplying it often enough?
Yes, that's a big, I will train you how to do that. That's a big, if you want to be a client, you have to follow the rules. That way we get the best results.
How often do you see people for facials?
Every day.
Every day.
And
you have people come in once a month, once every 3 months?
Usually it's like a 4 to 6 week interval. I do have patients that want to come twice, a year. And those are the patients where I say, we got to do stuff in between. So let's do good product at home as
well, thank you. I learned something. Don't forget to put those retinols back of your arms, knees, face, neck, chest, and of course, sunscreen. For more information, head over to cw7az.com. Thank you so much.
Thank you.